Hi, everyone, and good afternoon. My name is Steph Knoll with the Oregon Trails Coalition, and you are logged in with to the Oregon Outdoor Recreation Summit's webinar, Health and Nature Partnerships, a Toolkit for Program Development. We want to start out by giving a big thank you to all of our summit sponsors for supporting this year's program. I have a couple of quick housekeeping notes to kick us off to make sure that everyone hopefully has a good experience on Zoom today. First of all, I want to let folks know that this session is being recorded. And we intend to share recordings of most summit webinars, including this one, on the Travel Oregon YouTube channel following the summit. We're going to do that in one batch, so that'll be a couple of weeks out, but we will send out links to those recordings to all summit participants when those are available. Today's session is going to be a brief presentation followed by an interactive workshop. So just want folks to be ready for that and ready to participate. There'll be a couple of different options, which kind of Courtney will walk you through for how to participate then. And want to let you know that throughout the session, if you have questions for Courtney, you can use the Q&A feature in your toolbar. It's probably at the bottom of your screen. Feel free to drop questions you have in the Q&A at any time. And Courtney may get to them during the course of the presentation, or we plan to have about 10 minutes at the end available to get to those remaining questions. Also, I will be running tech support for today's session, so you can look for my name, Steph Knoll, in your chat. If you have any technical questions, if I can help you out to make sure you're able to access everything that you need to. And one last thing, when this session concludes, you will see a survey link kind of through SurveyMonkey probably pop up in your browser bar. So we would love to have your feedback and just a very short 2-minute survey right after the session, or you may also receive an email link to that kind of 24 hours from now. So that wraps up our housekeeping, and now I have the privilege of introducing today's speaker, Courtney Schultz, Executive Director of Health and Technology Partners, LLC. So Health and Technology Partners is a consulting firm dedicated to improving well-being through cooperative partnerships with healthcare providers, communities, and natural resources. In addition to leading research projects for universities, local, state, and federal agencies, Dr. Schultz currently is adjunct faculty in Parks, Recreation, and Sport at University of Missouri-Columbia, serves as the research fellow for Parks, how do I say that? RX, Parks RX, Prescription Parks.
Parks America.
Okay, thanks. Should have checked in about that before the intro. America, and is a Shift Emerging Leader and sits on the advisory council for the Shift Emerging Leaders program. Today, Courtney will share how to integrate nature-based physical activity programs into your outdoor recreation lands through a series of guided exercises for developing community-focused health and nature programs. This interactive workshop will provide a framework and guidance for customizing a program that best fits your agency's intentions, your community, your budget, your partnerships, and your commitment to diversity and equity. Thank you, everyone, for joining us today. And now I will turn it over to Courtney to dive into the session.
Wonderful. And thank you so much for the kind welcome, Steph. And thank you all to everyone who is here participating in this afternoon. I know it is a long week, mainly these days, increasingly. So I do appreciate you taking the time out to join us in this conversation. So I just dropped a link in the chat function for those of you who are following along. We will be utilizing the toolkit. So there's a couple of work pages in there. So if you want to go ahead and download that workbook, it'll get us started a little bit later into the presentation. So to get us started, I wanted to take a little bit of time to really talk about this idea of what health actually is. You know, we talk about this dynamic between health and nature without always taking time to really recognize what goes into health. And one of the great definitions that's out there is actually from the World Health Organization. And they talk about health as being very multidimensional, that it's a state of complete physical, mental, and social well-being and not just the absence of disease or infirmity. And so when we start to think about health in these ways, we really understand how public lands, how outdoor recreation fits into that dynamic so well, because health depends on our ability to understand and manage the interaction between human activities and the physical and biological environment. But when we look at what's going on in the United States around this idea of health, we know that there is a gross mismatch of where we spend our money and what's actually influencing health. And so on the left-hand side of this graph is a quick little look at the determinants of health. These are the different things that impact your health outcomes as an individual. And so something like access to care really only determines 6% of your health outcomes. But yet when we look at expenditures, 90% of what we spend in this nation is on that 6%. And when we start to flip the idea of how we look at this, we begin to understand that natural spaces can impact up to 74% of an individual's health determinants. And in Oregon, we understand what this message means. So a report a couple of years ago came out that looked at the fact that $1.4 billion annually in healthcare savings are come about by reducing chronic illnesses. All of this comes about because Oregonians are getting outside and being active through outdoor recreation. And so when we begin to look at this, it's useful oftentimes to think about a framework that begins to make sense of what these connections are. And so there are two main theoretical frameworks that I offer for you as a suggestion for beginning to really position this idea of the health and nature connection that exists for human health. The first is biophilia. Biophilia suggests that immersion in nature is inherently satisfying, right? That as individuals, we are drawn to these nature spaces. But we can take that one step further. Self-determination theory really argues a little bit beyond that and states that humans have a basic innate need to connect and relate to others and the world around them. And so there's a part of us that really is drawn to these nature spaces for so many different reasons. And when we begin to look at this idea of what the nature health link is, there's a very useful framework borrowing from the work of Dr. Quo and Hardig, who have developed a lot of different ways to look at this. What you see in front of you is this dynamic framework of how this nature health link kind of manifests itself in the real world. And so we start with something very basic, nature exposure and contact, spending that time in nature. But it requires some active ingredients. And those active ingredients might be something like faunticides, which are aerosols given off by trees, that smell of a forest when you go on a wonderful hike. Things like environmental biodiversity, the sights and sounds that you encounter when you're in these outdoor spaces. And that nature exposure and the active ingredients combine to create an impact on a number of different things. It impacts our physiological and our psychological states. It impacts our behaviors and conditions, all manifesting in several health outcomes that increasingly, as you look to the body of literature, more and more, several thousand research articles now are starting to draw this connection. But there's still a need for more experimental research. And so part of getting at that experimental research is actually developing programs at the local level that allow us to really start to get into the minutia of what's going on. So we know that nature provides multiple health and well-being benefits. Well, what does that mean when we actually start to look at it? Well, there's a number of physical benefits that come from being in nature. We know that being engaged in nature, having exposure to nature, reduces illnesses and diseases. It can increase the number and activity of things like human natural killer cells, actually helping cancer patients who are going through treatment. It also improves our general physical health, reducing that blood pressure, improving pulse rate, helping you sleep better, reducing nearsightedness. It can reduce headaches even, but also it encourages physical activity. And that combination of physical activity, but physical activity outdoors, creates a greater feelings of revitalization, increased energy, greater satisfaction, and lowers that risk of obesity. But it's not just physical benefits. We also see a number of psychological benefits. And if you've been hearing all of the swirling talk around the year that 2020 has been, it's been a tough year for many of us, from wildfires to social justice unrest to all of the different things that we're facing, just dealing with the pandemic of COVID-19, right? Things like stress, anxiety, depression have really come to the forefront of a lot of national dialogue. But we know from the literature that this too is where nature can be of great benefit. So things like cognitive function, reducing that mental fatigue, improving ability to perform tasks. When you're getting burnt out on those Zoom calls, stepping outside for 5 minutes can have those great benefits to revitalize you. But also psychological wellness, right? It increases self-esteem, improves our mood, reduces stress, reduces anxiety, and can improve behavior, especially seen in classroom studies with adolescents. but also mental illness. Contact with nature improves so many different aspects of mental illness, from depression to anxiety to mood disorders to even addiction recovery in some preliminary studies. But it also increases social health benefits. It helps us connect as a society, increases our sense of belonging, promotes social ties, reduces crime rates, reduces violence, and allows us to build resiliency as a community. So there's a number of ways when we start to think about this idea of the intersection between health and nature, that it's beyond just the individual. We see these health benefits for the individual, for the community, but also a little bit broader than that, of thinking about how then these communities can begin to fit together in greater cohesion. And that's where it's also important to think about this idea that nature can be very important for creating pro-environmental behaviors. Many of you in this space right now do a lot of outdoor recreation work. And so we're always talking about that idea of creating the next generation of conservationists, redefining the term of who is a conservationist. Well, what we're finding increasingly from the literature is that these nature interventions that increase contact with and connection to nature actually help improve human and planetary health. In diverse populations, they promote that idea of pro-environmental behaviors. They promote nature contact and overall well-being, which is something that is at the heart of a lot of the missions of our organizations and respectively the work that we're trying to do in the outdoor recreation space. And so what all of this built up to was an understanding that we needed to delve a little bit deeper into these connections and figure out how to support different organizations, land managers, public lands, different outdoor rec organizations trying to do this work. And so under a contract, the National Association of State Park Directors commissioned a study in conjunction with myself and partners at North Carolina State University to look at this idea of what is this health and nature connection and how do we support programming for our local state parks and for agencies who are trying to do this work. And so what came out of this was a massive report and a toolkit, which is the link that I dropped you at the beginning of this conversation. And this report works in a couple of different ways. It's comprised of 3 main sections. We conducted in fall of 2019, 9 interviews with state park directors, consultants, development individuals, park superintendents across 7 different states to get a sense of what's really driving their desire to be a part of this health and nature connection. What is maybe preventing the development of some of this program? What is required for sustainable program development? And how do we begin to integrate such programs into the culture of our agencies? The second part of the report is a profile of 9 different national and regional partners who have successfully implemented health programs for a number of years. So learning from them, providing an opportunity to look at case studies from a very bespoke model, custom designing this style of programming for your organization, to programs that are a little bit more plug and play. So for instance, we featured and interviewed and worked with Walk with a Doc, an organization that has international reach, in which physicians are able to become a part of the group, have a local chapter, and do something as simple as lead a group of their patients outdoors for a walk. And in that program, some of the really neat things that come out of it is the fact that it breaks down these barriers. It breaks down kind of the hierarchy between provider and patient and allows for some really interesting dialogue around broader health impacts of how patients can reclaim and retake control of their treatment and being proactive with their health. So something like that is a great example of a plug and play program that you might get affiliated with or bring into your land. Other examples are things like Prescription Trails, which is one of the pioneering organizations that looked at this idea of creating an entirely new system of how we rate trails and rating those trails with diabetics in mind and figuring out how we look at the ease or difficulty of that trail and how it would fit into different considerations for individuals who carry chronic illnesses or chronic diseases into that space and what their considerations might be when we talk about trail access. So the really great thing about these profiles is it provides a really wide overview of all the different models that exist out there to help spark your own creativity, to think about the different things that you could be addressing in your community and bring together that intersection of great ideas, good execution, and inspiration for how to successfully and sustainably create these programs for your own organization. And finally, there's the action plan. The action plan was created with prompts and exercises in 4 areas that would encourage and challenge you as an organization to do some internal work to figure out how you fit into this broader community network of providing health and nature programming. And so what we're going to do for the workshop portion of this presentation is really delve into what that looks like. But if you were to pick up that report, you'll notice that while they're labeled 1, 2, and 3, you can start anywhere in this report. The whole idea is we wanted to develop a resource that would be readily usable by land managers, by different organizations, to figure out how they can really support their community and work with their community to create these positive health benefits and health outcomes locally, state level, and even nationally. And so what we're going to do now is we're going to take a little bit of deep breath. We're going to check in on the chat box real quick. But what I would love to know from you guys is who you are and where you're from. If you don't mind, drop it in the chat box. Let me know your name, where you're from, organization, and let's get to work on this. So we'll give you guys just a few minutes to drop in some comments there.
And if folks want to adjust their chat settings so that it says to all panelists and attendees, folks will be able to see what other attendees are joining as well. We have 51 participants total right now.
Awesome. So we see some comments rolling in. It looks like we have quite a few Park and Rec, some Department of Fish and Wildlife, some local organizations, quite a few local organizations, some nonprofits in there. So hopefully this also gets you a sense of who some of these potential partners might be. I think a key part of this is remembering you're not alone. You're part of a bigger network of individuals and organizations who are really striving for this whole thing about bringing this health and nature connection to communities. So as those comments continue to roll in, we're going to go ahead and get started on this first worksheet. So one of the things that's really important in terms of requirements for a successful program, to be successful in creating these health and nature programs, you have to be honest about who you are as an organization. And that means you have to define your goal. And this is where I think a lot of times I have seen, as I've done work across the nation, where organizations lose their way. Right? We get excited at conferences, we hear a really great idea, and then we often try to just plug and play in our own community and wonder why it didn't succeed. And so what I want to challenge you to do is think about a couple of main questions. So on the left-hand side of the screen, you can see the worksheet. Again, it's in that PDF link that we shared, and there's going to be opportunities for you to download this. But for today, as we're going through these worksheets, drop in some goals, drop in some responses to this so that we can begin to learn from each other. So first and foremost, why are you introducing health and nature programming as an organization? What's your mission? Where does health and nature programming fit into that mission statement? So go ahead and drop some of those answers into the box for us. Thank you, Jill. So Jill is talking about the Oregon Park and Rec Department to provide and protect. Right? There's that duality in a lot of our mission statements: provide entertainment opportunities, engagement opportunities, while protecting the natural resources. And sometimes these programs can straddle that line a little bit. That can be a little conflicting. But one of the big things that we learned in doing this project with state park directors was the fact that time and time again, we found out from these interviews that they didn't know the why, the who, the what. So they joined onto this idea, but without really considering how this program was going to fit into their broader mission statement. And so as you're hearing some additional chats coming in, we have a representative from Hike It Baby who's talking about those opportunities created. We have another participant who's talking about creating and promoting outdoor activities for locals and visitors. So there's a number of ways that our organizations are set up to be providing these different interfaces with communities. But here's the other thing I want to challenge you as you start to think about the mission of your agency and your mission statement. Which constituents will the program target, and what health outcomes will the program seek to address? Right? At the beginning of this presentation, I gave you a 10,000 foot level elevation look at what health looks like as it relates to nature. Too oftentimes we try to do very broad programs that are going to improve the health of the community. Well, that's a hard thing to do if you haven't really thought about who you're engaging, why you're engaging. And that certainly makes it difficult if you're thinking about things like a trail. For instance, I'm working with the US Forest Service right now to complete a program and a research agenda with them looking at what makes a good trail for forest bathing. How do we take an existing trail and retrofit it? How do we design new trails for forest bathing for ultimate outcomes related to health? Well, in order to focus in on activity, it really let us begin to think about what then those health benefits and outcomes might be. So one of the things that I would love to encourage you guys to do is really think about that idea of which constituents the program will target and what outcomes specifically you're seeking to address. So the second worksheet that I want to work you through is this idea of building partnerships. If you're here at this conference, chances are you believe in partnerships and you probably have several partnerships that exist already. But what I really want to encourage you to do as we think about this new kind of frontier of health and nature programming is to begin by really doing an internal assessment. Who are those individuals within your agency? And then think about a ripple effect. Start with those individuals within your agency, then think about your broader community. Who has skills to share? Who can you bring together with unique strengths to help you reach your program goal? And one of the things that we often take for granted is this idea of how to develop teams, right? We do it every day. You're probably Zoom fatigued beyond belief at this point. But one of the things that really make a health and nature program successful is really looking at this idea of assessing to develop these programs. And so sometimes it can be a bit overwhelming, right? Those of us who come from an outdoor rec background, myself included, I come out of a recreation background, is really to provide recreation and leisure opportunities. And sometimes putting a health lens on that can be a little intimidating. So what I want to encourage you to do is think about those skills that your team has versus skills you might need from a partner. And as you weigh that back and forth, really balance that out and think about then what community members would be really useful to invite to the table to shape a whole new program that maybe you never thought about. So in the chat, answer this question for me. What skills do you feel you don't have as a team that you're always looking for help from a partner organization? What are you struggling with when it comes to these programs? Awesome. So Pamela just dropped in a wonderful comment about people of color outdoors working to reconnect Black, Indigenous, and people of color to nature. So right in that mission statement, right, is a very clear idea of who they're targeting. They're talking about, outings that are educational and connecting other groups to expand experiences. So that's something I love to talk about, right? Is this idea of leisure socialization, how we begin to have access to these programs. Laura Ferguson, thanks for jumping in. She talked about money, very small community, limited resources. At least half of you are probably nodding along, right? Finances is always that thing that seems to limit a lot of what we're trying to do. Another individual says, partner with community health advocates who can reach people who want to improve their health. So that's an interesting dynamic. So I hear this time and time again from land managers and individuals more on the outdoor rec side of things, is this idea that if we can connect in with healthcare systems, somehow we're going to do it well. Might I encourage you to stop looking at healthcare providers and look to auxiliary members within the healthcare community? Nurses, nurse practitioners, occupational therapists. Those individuals tend not to be clustered into how we define healthcare, but are often the individuals that have the most face-to-face time with patients, have the best pulse on what's going on in a community, and can oftentimes help you get beyond the barriers of the gatekeepers at institutions to actually create those partnerships. Some other individuals were talking about volunteers, the struggles and the benefits that come with those volunteers of, having very dedicated older volunteers, but also needing younger volunteers to get involved. Yeah, so a lot of another individual came back to talk a little bit more about those local health partnerships, and they're absolutely wonderful to do, right? So, what I really want to hopefully leave you with as we're thinking about program goals and what that means when we start to look to partnerships is get creative. A lot of times we talk about being limited by money, it's a reality, limited by our own staff, right? They're overworked, underpaid, and don't have the bandwidth to take something else on. So that's where we start to get a little bit creative. And that's where I want to step into the third worksheet. And that's where I'm going to ask you to take everything you just brainstormed and kind of throw it off the table. And I want you to think about creative dynamic solutions. What would it look like if you let your true north guide you to the programmatic approach that achieves your program goal? And so when we talk about true north, that's kind of just a cliche way of saying staying true to your mission, staying true to what you do best. And when you're in talks with those partners, what if instead of really pushing for that park prescription program, you ask them to say, if we had no barriers, if money wasn't a limitation, if staff wasn't a limitation, what would the community actually need? And what would it look like if we started to work through different things? And this is also the point in the process where you can have a really great understanding with your partners to kind of think through some continuums. So the worksheet that's presented on the left-hand side is going to walk you through 6 different continuums to help you start to really shape, well, what program is actually right for your organization and right for your community. So thinking about program design, do you need something that is a bespoke program, right? Completely focused in on addressing the communities you're starting and struggling to reach, or know that you need to serve better? Are you somewhere in the middle? Could you do a partly adaptable program? Or are you needing something that is absolutely a turnkey, right? That plug and play, you drop it in and go, and maybe it's your starting point. But let's talk about program frequency. How do we get away from these one-off events and actually build programs that occur with some sense of regularity? Those were the biggest lesson that we heard from our state park interviews, was to break that model where we do these, annual one-time programs and then leave our community wanting more without fulfilling that obligation. So how do we start to really structure that into our forecasting of budgets, our forecasting of how we're training staff and engaging staff in these programs? But also thinking about program content. Who are you as an organization? Are you really looking to push forward this agenda by being completely healthcare integrated? Or are you more still dedicated to the outdoor rec conservation side of things, where maybe you're talking about this concept of health and nature as an interpretive program? Thinking about where you slide along that continuum can really help you find better partners for things like funding. Program staffing. If you don't have a dedicated staff member with the authority, the autonomy, and the actual ability to make decisions on the program, these programs tend to fail. And so what I have found in doing this work across the nation is making sure that as an organization, you commit to changing your culture, to actually integrating this style of programming, and you empower that staff person with the resources and the support that they need to actually execute this on your behalf. So thinking about, do you not have staff you can do this with? Or do you have at least one full-time park staff that you can do this work with? And what does that look like as you start to work with those partners? Things like program funding. It's a reality. We have to have the money for this. But can you do this as a self-supported program? Can you do this as a grant foundation funded? Can it be somewhat agency subsidized? This is where we begin to get creative. And by having that true goal and a very clean goal, it's actually going to make that funding aspect of this a lot easier for you. And finally, program training. Are you going to be able to provide the training in-house, or do you need external staff development? So one of the things that's really been emerging in this particular field is, while more and more healthcare partners are turning to land managers and outdoor recreation to provide these opportunities, we often need to think about, well, what is the user experience? What is our visitor experience? Do we need to be retraining staff who function like greeters, who function like park rangers, to have more firsthand knowledge of having conversations around what that park prescription might be? Have you educated all of your frontline staff so that they can answer questions about what trail works really well for different chronic illnesses? So we begin to change the whole culture by thinking both of the front of how we present to our communities, and also on the back end of thinking about what values and ethics we are pulling through this, to make sure that we're not just throwing a program out there, but we're actively changing the organizational culture. Now, you're probably noticing that I've kind of ranted on this idea of organizational culture just a few times. And that's huge because oftentimes what I find and what we found through our report was that a lot of agencies get excited about doing this work, but they don't actually think about how it's going to be integrated into the mission and into the overall culture. And that's where you have a lot of dissonance as an organization. And the moment you have that dissonance, that's where insincere, inauthentic programs begin to emerge that often cause harm to our communities. And so we want to be very good stewards of these efforts. We want to be good stewards of inviting and working with our communities to be addressing these salient health concerns. And in order to do that, we have to make sure that organizational culture is changing. And hopefully having something like these worksheets can help spur some of those honest conversations within your organization to really come up with those dynamic solutions that you didn't come to originally, but as you begin to workshop this and think about this idea more, you're able to develop a little bit more. And finally, the fourth worksheet that I really want to talk everyone through is this idea that you're planning for something real, right? Funding came up. Well, typically funding comes from an external source, which means there's some sort of performance measures and metrics that you're going to need to utilize in order to show that this program was effective. We're talking about data. Now, for some of you, that's an absolute no-go. When we start talking about numbers and data collection and research, you might feel a little over your head. But the reality is data provides insights so that you can make informed decisions about your programs, be the best stewards of your resources, and really make sure that you are having a positive impact in the communities you're working with and are really quickly identifying when things have gone off the rail so that you can mitigate any harm that might have unintentionally come around. The reason I say it that way is we're engaging a number of audiences and we are all on a different journey in our path of figuring out how to be good stewards, how to be good community members, and how to engage everyone equitably, fairly, and treating them with utmost respect. And sometimes we misstep. So how do we plan for measuring those misstep moments? So I want to ask you all, jump in the chat, join the conversation. When you think of health and nature programming, what are key evaluation metrics that come to mind? Are you collecting any of this data already? Tracy, thank you. Yes, number of participants in the program. That's a pretty easy one, right? When we think about trail reports and outings, number of participants, that's an easy one to knock off. What else are you guys measuring? Participant satisfaction, how often people are returning to the program? Absolutely. Changes in behavior, impact, is it continuous or one time? Absolutely. Number of volunteers, if they're new, if they're returning. Feedback, surveys. Nicole, do you mind sharing a little bit more about exactly what kind of feedback and what kind of surveys you're asking? Awesome. So while you guys continue to roll in with the conversation, I want to talk about what some of these domains are. So a lot of what you've been talking about are kind of these program characteristics. These are the really easy things that we have been trained throughout our career to readily collect, right? Weather reports, program staff, time and date of the program, participant demographics, a breakdown of participant directory information, location of the program activity. All of this is, those things about, who's showing up, what we're even offering. Then we start to move into things about program performance. That again is something that a lot of you are already doing. Things like attendance frequency, number of participants, group size, number of social media interactions, reposts, likes, especially in a COVID-19 world, thinking about how we're still engaging with our constituents and our user groups. Percentage of first-time attendees, right? We're hearing that time and time again, especially around these volunteers. Who's new, who's returning, and return on investment. calculating those performances. And then we start to move into things, Nicole, thank you for answering my question back, looking at things like participants' experience, those things of something as simple as testimonials, changes and attitudes, knowledge, behaviors, awareness of nature benefits, motivations or barriers to participation, right? As brilliant as we think we are as program designers, we probably have a blind spot, measuring what that blind spot is. Also adherence to things like if we're partnering with a healthcare community, adherence to the prescription. But then we get into what goes from kind of basic programmatic measures into true health outcomes. And that becomes things like measuring the participants' health. And this is where it is often very beneficial to partner with an academic partner or a research partner who can make sure that you are complying to IRB, Institutional Review Board, making sure that all of the data you're collecting is done ethically and is done to protect your participants. But that's where maybe you're doing something that like the forest bathing in Japan and collecting swabs of the mouth to check for cortisol levels of your participants. Maybe it is collecting blood pressure before they go into the program, after they come out of the program. And so there's a number of different biomarkers that we can be utilizing to measure some of the impacts of these programs, and a lot of different ways that we can begin to look at physical activity levels, right? If you have an Apple Watch or if you have a Fitbit, all of these devices that exist in the market that allow us to very readily collect secondhand data that gets at that actual measurable impact quantitatively. But we also have things that we can use. Several of you mentioned these different scales, right? This is what I love. I'm an absolute data nerd and geek. There are so many wonderful scales, surveys, approaches that we can be using to measure a number of different outcomes that have all been validated that can be launched in a number of different ways. So another thing to keep in mind with this, once you've settled on what you're evaluating, think about how you're evaluating, right? Sometimes all you need is a clipboard, a piece of paper, and a writing utensil, and you can collect a lot of this really good data. But we want to think about how we take that data into analysis, and that's where maybe sometimes doing things like email surveys with your participants, ecological momentary assessments, sending them a text message with a short survey, asking them to respond back to it. All right, there are so many different approaches, and this is where I encourage you to really get creative about thinking about what some of those broader approaches might look like and feel like as we begin to move forward and building this out. So that is it for this last worksheet. What I want to do now is transition into answering some of the Q&A. So you guys have been absolutely dynamic talking in with the chat, but now I'd love to hear your voices and answer some questions in the remaining time we have.
So if folks want to use the raise your hand feature, I'm happy to help you unmute if you have a question you would like to ask verbally, or folks can also drop questions in by typing them into the Q&A. Pamela, I just permitted you to talk, so you should be able to unmute yourself.
Can you hear me?
Yes.
Okay. I was just wondering if we can get a copy of the link to rewatch this. Or can I get a list of the participants that entered their info into chat?
The two things that we're able to provide is we'll be able to provide this webinar recording following the summit. And we don't have specific permission to share contact info from the folks who signed up for this webinar specifically.
Not the ones that signed up, but the ones that shared their information in the chat.
We do have a list we can share of everyone who registered for the summit who opted into sharing their contact info.
All right, thank you.
Yeah, and it looks like Ashley Hicks is volunteering her contact information. So that is probably a great start for you there, Pamela, as well.
Thank you.
You've started a trend. The emails are coming in. And so please do. I would love to open this up to, if you have a call, if you're looking for a partner and you want to take over the mic and talk about a little bit about who you are, what program you're developing, and what resources you're looking for, partnerships you're looking for, please step up. I would love to open this forum to help make some of those connections. Seth, yes, slides will be sent after the seminar. So you will actually be able to go to the healthandtechnologypartners.com, and I will have these slides available for those of you who are looking for a copy of the presentation before they are posted to the YouTube channel. Like Steph mentioned, all the webinars from this particular series will be posted in a few weeks. They need the time to get everything processed and uploaded, but absolutely.
The recording will be available in a couple of weeks, but I'll also connect with Courtney about what links we can send out as early as tomorrow in the webinar follow-up email. We would love to take any more questions, either you can raise your hand and you can ask your question verbally, or post it in the chat if that's easiest for you, or the Q&A. We're kind of keeping an eye on both right now. Or, as Courtney invited, any pitches folks want to give for what you're working on and what kind of partners you're looking for.
Seth, yeah, Blue Cross. Obviously, this toolkit and study was funded by Blue Cross Blue Shield of North Carolina, the foundation there. And a lot of good work has been coming out of Blue Cross's collaboration. Track Trails Kids in Parks program is run by a good friend and colleague of mine. And so absolutely wonderful program. For those of you who don't know about the program, it is a wonderful opportunity to create these outdoors prescriptions with a number of things, with interpretive signs for your trail, with brochures. Kids in Parks provides all of this material. There is a small fee associated with it, but they provide these beautifully artistically done illustrations customized to your location, and come in and really help you set up these trails so that you can be offering the self-guided program for youth in conjunction with their pediatricians. And the great thing about it is it's incentivized. So as these children are completing and marking off different things in their brochure, they have an opportunity to get different swag from Kids in Parks, which if you know anything about kids, something as small as a sticker can be a great incentive there. Jessica put out a great call. Jessica, did you want to mic yourself, or I'm happy to read it? Cool. So Jessica is putting out the notice that Hike It Baby is looking for potential partnerships, volunteer advisors, and or board members with interest in developing strategies around the health benefits for families spending time in the outdoors. They have a national community of families who are engaged and love spending time outside. Jessica, I'm interested. So if you want to send me an email, that would be fantastic. But this is a really cool thing, right? So one of the things that we didn't have an opportunity to talk about in the presentation is this idea of family dyad. So a lot of great work has come out of Dr. Nushin Rizani in California, who's really looked at that dynamic of what happens when a child and a parent or a caregiver, primary caregiver, are out in nature, and what that does to strengthen the overall resiliency of the family as individuals, and what that looks like as they begin to cope with a lot of things like adverse childhood experiences, right? Those ACE scores have a huge impact on your overall quality of life. So very, very cool opportunity that Jessica and Hike It Baby are offering for those who are on the call. Ashley Hicks says that she's been doing river cleanup for 8 years, supported by SOLVE organization, always looking for volunteers as well. So keep that in mind. Any other thoughts, questions on what you're struggling with? Excellent. So it looks like there's an anti-poaching campaign looking for partners to promote messaging on how to report poaching in Oregon. Always an important thing. And right, that gets at this idea of how can you start to leverage maybe those participants who are coming up for the health and nature programming to start actively being stewards of the landscape. Jessica, that is a great question. I have a slide for that. So on this slide, you will see my email as well as the website. So feel free to contact me if you want to have a conversation one-on-one. I would love to be a resource, to be a sounding board for you if you have thoughts and concerns about how to do this work. But Pamela, it sounds really great, the work that you're doing. A lot of the work that I've done is actually with the DEI lens and working with these communities that have often been overlooked when we stop thinking about what social memory around trauma and even social memory around definitions of nature looks like, right? When we say the word nature, it is so laden with a very Eurocentric romantic image of snow-capped mountains with an eagle soaring over it. And the reality is nature is all around us, right? It's the succulent collection on the bookshelf behind me. It's, you know, that dandelion that's growing up in the crack of a sidewalk, and really thinking about what language we're using as we're talking with different communities and making sure that we're being very respectful of what their experiences have been. So looking forward to continuing this conversation. Ashley Hicks wrote in about a project looking at unhoused living on the riverbanks and in parks. Always a very important topic, especially in the Portland area.
Courtney, I was curious, as I kind of scan through, you know, a lot of our attendees, I think it's a lot of folks coming from really the outdoor rec side, you know, as opposed to necessarily coming from a health and research background. And so you mentioned earlier kind of when folks get more into wanting to study health outcomes, you know, kind of connecting with folks from kind of health or research. Do you have recommendations about kind of where to start in terms of building those partnerships? Kind of what university departments to, you know, start those inquiries with, or how else to start reaching out and identifying those partners?
Yeah, that is a wonderful question. Thank you, Steph. The first way that I would recommend building these collaborations, especially around research, is look to the national leaders who've been really doing this work. Ship Jackson Hole is a conference that over the last 3 years has really recommitted from being mostly conservationist focused land management collective to focusing solely on this connection of human and nature health. And so they bring to the table a number of public land agencies, a number of universities, a number of researchers such as myself, who have all kind of committed our research life to really exploring what this means. So I think that can be a really great opportunity. This is going to be a really nerdy academic thing. Utilize scholar.google.com, right? For those of you who are maybe new to research or are unaware of it, I see a little face. The cool thing about this is it's going to give you a number of articles. Some of them are behind the paywall. I acknowledge that that is such an issue in academia, but there's a number of resources that are going to be on there that'll help you understand who the researchers in your local community are, and more importantly, who some of the national players are that align with your focus, right? So we heard from Hike It Baby. There are a number of national research centers and organizations that are really focused on youth development, right? I myself just finished up a project in DC public schools in looking at how to integrate park prescriptions in the school setting, and developed a whole school curriculum that educators can use that is aligned to health standards and teaching standards that helps move this forward. So sometimes it's as simple as kind of looking beyond the scope of field that we know and learning a little bit about that. But certainly academic resources can be a great way to get at that.
We also have a new question in the Q&A from Yvonne about how are you networking and meeting new people in our new COVID environment in regards to this partnership development?
Yeah, so that is such a good question, probably one that is really weighing on us. Conferencing looks really different, and networking at conferences looks incredibly different. And so one of the things that I've actually found has been really successful is cold calling people, sending them that email, asking to set up just a phone call, no Zoom, no anything, just to chat, just to get a little bit of information. Especially if you're reaching out to academics, we tend to love to talk about ourselves, and we tend to love to talk about our research. And so that can be a really easy way to start developing these partnerships. I think one of the things that we all forget about is it's kind of the grass is greener scenario, right? We're looking over the fence at who these other individuals are, whether it's healthcare or researchers, and it's easy to get intimidated. Whereas from my seat, you know, I'm looking over the fence trying to figure out who are the local community organizations that would want to partner with me, that would be willing to work with me and to create something collaboratively. So be bold. Email is a great way to start those connections, and ask for, that 15 half-hour chat can be a great way to network and keep moving things forward, even in COVID. There's a lot of planning happening right now, and now's a great time as an organization to prepare and do a lot of that internal work so that when we can do more social contact, you're ready to launch.
We also have a reminder in the chat from Claire that county health departments can be huge resources in terms of these health partnerships.
Absolutely. So I should put the disclaimer out. My dissertation, when I was completing my PhD, was funded by a state health department. So these can be amazing resources. And Claire, thank you for bringing it up. I was remiss to not mention that. Whether it's county, whether it's state, health departments have really grasped onto this idea of the importance of nature spaces, whether they're green or blue or brown nature spaces, and the importance that they play in community health. And so you have some states that are progressive, like Minnesota, that is actually including things like the social determinants of health as something that falls under their purview, and have added park access to that, and are now requiring things. You have states like state of California that has looked at access to nature as an important measure for pediatric patients. And so now you're able to actually build for that as a healthcare provider. So wonderful, wonderful opportunity for resources and collaborations there.
We have a few minutes left if there are any final questions for Courtney or for the other attendees on the call. Maybe as we give kind of folks a chance to think about if they have any more questions. I know, Courtney, you shared a couple of neat case studies kind of in brief at the beginning of your presentation, but I'm wondering, if there's, since we have a few minutes left, if there's just kind of another, either going back to one of those in a little bit more detail or something else that you've just been personally excited to see happen.
Yeah, that's a great question. There's so much innovative work being done right now that is making me just absolutely geek out. And so I think one of the things that's been really cool is the burgeoning growth of local programs driven by communities to really address these certain health topics. So Prescription Trails that started in New Mexico is one of the founders of this. And what was really neat is that they really planted a flag in the sand and said, we're going to address the rising number of diabetes cases that we're seeing in the US. And that was 15 years ago, before the diabetic epidemic really exploded, right? We're seeing unprecedented numbers in low income and rural communities right now. It's really a silent epidemic that's happening in the US. And so what was really neat about them is they worked with the National Park Service. They designed their toolkit and their workbook, won awards for the design and integration of how it went, and was just such a great example of how by having a narrow focus, you can accomplish a lot. And so several of the participants today have been really frank in talking about, trying to reach out to those BIPOC communities, having a really specific focus. And so looking to some of those successful organizations, Outdoor Afro was a wonderful example of an organization that is really doing health work, even though they started with the community first. And so when we start to think about what these case studies are, you can look to things like forest bathing, right? That term is a little woo-woo for some audiences, but thinking about how you can maybe take that concept, right, of intentionally spending time in nature, focusing all of your senses to the surrounding of the trees, maybe the coast, the waves, the different foliage around you, and what that means when we just take that time to unplug and engage. And so what I encourage all of you is, when you see these different case studies of what's worked well, think about how you break it down for your community and really make it authentic to your community. And the ones that have been a national success did just that. They had a narrow focus, they knew what they were trying to accomplish, and they made it authentic to their community and continue to revitalize the program so that it stays relevant. They didn't get enamored with their own success. They were willing to take risks and revamp programs as time has passed.
I think that really sounds like like a great kind of nugget for us all to take with us kind of as we come to the end of this presentation here. I also see some other great notes, I feel like, from our participants coming into the chat too, of some other case studies folks might like to check out. Dr. Tia Ho has done mindfulness walks and trainings with people of color outdoors. So that might be an Oregon resource for folks to look into. And Children and Nature Network has a great research library we're seeing from Jessica. And it looks like we have a question from Alan, and we still have a few minutes. I'm hoping to utilize the principles of eco-psychology into outdoor excursions with targeted audiences for psychological and physiological benefits. What is the best way to quantify?
Alan, I would love to have this conversation with you. So it depends. And I know that's a very academic answer. So the reason it depends is that what are you trying to measure and what is the intervention? So is this designed to be a pre-post? Are you doing a pre-assessment of where your individuals are before the excursion? And are you trying to do it after? Are you doing it for one excursion, or are you doing it for a series of excursions? And all of that starts to change what you might be looking at. So especially with thinking about eco-psychology, and there's a great field, outdoor behavioral health is another research realm that really targets this work. Psychological versus physiological. So physiological, a lot of those really good markers, again, are things that we can readily measure in the field, like blood pressure. Doing those cortisol swabs through saliva is a great way to look at some of those markers. Things like heart rate has a little bit spotty outcomes in some of the research. If you have access to a really great research field, mobile EKGs, doing things like brain scans while you're out and about in nature can be a fantastic way to do that. Out of Utah has been doing a lot of that really great work. Psychological, that's where we're looking at different scales of resiliency, where we're looking at scales of restoration. You're looking at things of cognitive performance tests potentially. And so all of that comes down, right? There's so many different things that fall under just those two categories of psychological and physiological benefits. What is it you're trying to show? What are you hoping is an outcome of your program? And once you've identified that, then it becomes really easy to say, this is the exact test, this is the exact survey, this is the exact measure that we need to prove this.
Well, thank you, Courtney, for responding to all these kind of good questions, and really doing your best with this kind of limited Zoom webinar format to really invite folks into an interactive workshop today. Really participate that work. Want to let all of our participants know once again that we will be sharing this webinar recording on the Travel Oregon YouTube channel. If you are a summit participant, you should have gotten an email in your inbox Monday with other summit participants' contact info. If you saw any comments made today and you want to reach out and get back into touch with someone you've heard today, hopefully you'll be able to find their name on that spreadsheet, and you're welcome to. You'll find my contact info on a lot of the summit emails and such. So if you need help connecting with someone, I'm happy to help you connect. That is one of my things I value greatest in this work, is helping people who should be working together connect. So big thanks to you, Courtney, today. And once again, thanks to all of our summit sponsors making things possible. Just want to give folks a little preview. Coming up tomorrow, we have our second outdoor film night, which is going to be really fun. It's going to be a kind of program mostly curated by our partner Filmed by Bike, followed by a conversation about representation in the outdoors. And Friday, we have a No Resource Left Unshared Friday forum. So especially for those kind of looking to do great partnership work in resource constrained environments, it'll really be talking about how organizations can go about sharing assets when there's not enough cash to go around. So looking forward to that presentation on Friday. So thank you everyone for joining us today. Do look out for that survey that will show up in your a tab of your browser or in tomorrow's follow-up email, in which I'll also make sure we get helpful links from Courtney into that follow-up email. And yeah, thanks everyone for joining us. Have a great rest of your afternoon.
Thank you, everyone.